first, I'm going to inspect bilaterally for the size, presence of edema, and venous patterning on the client's arm. Okay. Okay. The next, I'm going to inspect for skin color. So my client has brownish skin color and on her upper extremities. Third is to inspect finger for clubbing. Okay, ma'am. Okay, there's no presence of clubbing on your fingers. Then fourth is to palpate fingers, hand and arms for temperature using the dorsal surface of our finger. Okay. Okay, so my patient has warm temperature, not too cold, not too hot. Then I'm going to determine the I'm going to do the capillary refill on my patient. Okay, I'm doing one by one. So it is normal because just 1 second it returns to its original color. I'm going to palpate the radial, the ulnar, and the brachial pulse of my patient. Okay, ma'am. Radial, ulnar, then brachial. The other hand po. Radial, ulnar, then the brachial pulse. Okay, so I can feel the pulses on the 3 parts. Now I'm going to palpate the epitacular lymph nodes behind the elbow in the groove between the bicep and the tricep muscle of my patient. Okay. Okay, so now I'm going to perform Allen test on my patient. So, okay ma'am. So I'm going to, the radial and the ulnar arteries are observing for failure. Then I'm going to raise the ulnar artery and watch for color to return hand. Okay, I want you to close your hand po. Then open, close. Again, open, close, open. Okay, the other. Close, open, close. Okay, thank you. So for the assessment of the legs, I'm going to inspect bilaterally for skin color. So my client is already in supine position. Okay, so my client leg, both legs has the same color, although these are known to be a little darker than the rest. So next, I'm going to inspect bilaterally for distribution of hair. Okay, so the hair are so my patient is female, so the hair is not too strong and not too thick. Then inspect for radiation and ulcer. Okay, so I don't see any presence of lesion and ulcer. Then inspect for edema, unilateral or bilateral. So if the client has edema, determine whether it's speaking or monitoring. So if fitting, rate 1+2, 1+2, scale. Then palpate the client temperature using the dorsal surface of the hands. If it's cool, warm, or hot, then okay. So my client has warm temperature, although it's kind of cooler on the lower part, especially on her feet. Okay, next I'm going to palpate the superficial lymph nodes while keeping the gentle drips. If detected, note size, mobility, and tenderness. Okay. Next, I'm going to palpate the superficial lymph nodes while keeping the genital drips. So if detected, note the size, mobility, the tenderness of it. Okay, ma'am. Okay, I don't feel any lymph nodes or visual depression or okay, it's normal. Then next, I'm going to palpate and auscultate the femoral pulses over artery. So I'm going to listen for presence of glutes. I'm going to listen for if there's presence of glutes. Okay, using the diaphragm. Okay, so I did not hear any weird noise or sound. Next, I'm going to palpate the popliteal, the dorsalis pedra, and the posterior tibial pulse. Okay, so let's start with the popliteal. Okay, can you bend your knees po? Okay. Okay, I can feel the pulses. Next is to the dorsalis pedra po. Okay, next is the tibial pulses. Okay, can you please stand po, madam? I'm going to inspect for varicosities and okay, I'm going to inspect for varicosities and thrombophlebitis. Okay, ma'am. Turn po. Ikot po. Okay, thank you. You can sit po. To perform position change test for the arterial insufficiency where the client is in the supine position by placing my hands under both my client's ankle. Okay. That's po. Okay. Then next, I'm going to raise the legs 30.48 centimeter or 12 inches above her heart level, and I'm going to ask my client to pump the feet up and down for 1 minute. And okay, then pump your feet po for 1 minute. So next, I'm going to ask the client to have the client sit up and double legs. Then note the color of the feet, time the interval for color to return. Okay, can you sit po? Then dangle your legs po. Okay.